Good morning everyone. My name is Samiksha Vittal Gavande and today's my topic is case study. In this topic, we will discuss about the comparative observational study in the pharmacovigilance method. So, the case studies, there are mainly three methods or three studies are included in the comparative observational study. That is cross-sectional study, cohort study, case control study, etc. So, it is the observational study. In observational study, firstly we will discuss about the cross-sectional study. Cross-sectional study, it is also known as survey. Then the cross-sectional study is mainly used to observe the prevalence of diseases at a particular point. Cross-sectional study is used to estimate the multiple outcomes. Cross-sectional study, the main advantages is it evaluate or estimate the multiple outcomes of the patient. And the limitation of the cross-sectional study is the relationship between the exposure and outcome we cannot estimate directly. Second study is observational longitudinal study. In the longitudinal study, the case control study and the cohort study are included. The first one is longitudinal study. In the longitudinal study, use the multiple outcomes. We used multiple outcomes at a same group of population. It is based on the history of diseases. Longitudinal study, it includes first one is the case control study. Case control study is also known as retrospective study. Retrospective study, the word retrospective is simply said the past or backward data. The retrospective study, it is based on the backward looking study. Then the case control study, it have two words, that is case and control. The case is simply said the current cases, and the control is depends on past history of patient. Then it is fully depends on the exposure and outcomes of the disease. Then second one is the main advantages of the case control study is the case control study is easy to estimate and evaluate. Then second one is the cohort study. Cohort study and case control study is similar to one another. The cohort study, it is a part of observational study. In the cohort study, it is also known as prospective study. Prospective is simply said the forward looking data. That is the cohort study, it is also known as the forward looking study. In cohort study, it is based on the occurrence and exposure of the disease. In cohort study, it's performed on the similar group of population. That is the example, cohort study example, smokers. There are 10 group of peoples or population who have smoke. Firstly, the smokers have no disease and it take into the under the observation. Then wait for the occurrence of diseases. We all know the smoking contains the nicotine. That is, the exposure is nicotine and the outcome is the lungs cancer. Smoking which leads to the lungs cancer. Hence, the exposure is nicotine and the outcome is lungs cancer. So, these three studies are included in the comparative observational study. The first one is case control study, cohort study, and cross-sectional study. So it's all about the case studies of pharmacovigilance. Thank you.